I'm going to talk about STEP trials. So STEP is semaglutide treatment in patients with obesity, and this is a sponsored symposia. So that's my declaration that I've been paid to give this talk. So let's talk about weight loss. Very easy to say in the clinic, jaake vajan kama lo, this is getting better. Very difficult to do. Anybody who's a little bit obese will realize all the diets do a lot of flip-flopping, and eventually they don't work. And one of the reasons it doesn't work is that because the hedonic drive kicks in, and also the satiety center has to be managed, which doesn't get managed with diets. Diets work for a short term because you have a goal, you're getting married, somebody is going, you want to look nice. After that event is gone, boom, everything goes flip flat. The reason I feel is that because the body has a vetostat. So there is a thermostat in which our temperature is maintained, and I think the body has a vetostat. Body wants to be in that weight. So आप force करके थोड़ा इधर लाते हो, लेकिन वो धीरे से फिर rebound हो जाता है because you cannot follow what those diets for a longer period of time unless there is a driving force for that, which is triggered by something that has happened or some illness that has happened for which you don't have a choice. So we have now semaglutide that is available, and that has got a lot of homology with 94% with the human GLP-1 analog that exists. So this is the Wegovy pen. As I said, it works by improving the satiety. So whatever you eat, you get that satisfaction in the brain and you stop eating. That is when we stop eating. And that's when the idea is that you eat smaller bites, because we eat bigger bites, the signal takes time to go. That's why all weight people say take smaller bites so that that point comes earlier. And obviously reduce the hedonic drive, because there's something called executive function which you can control. But hedonic drive is, Manoj puts a rasgulla in front of me, which is my favorite sweet, and how much I can control it. So that's important for us to control. Now, Wegovy has been looked into a lot of trials. So we're going to focus primarily on step 1, step 4, step 5 to look at what happens with the weight loss. If we look at all step trials, some fundamental points are same in all trials, and that is what I'm going to say. A, this was taken patients with a BMI more than 30 or BMI more than 27 with risk factors like obstructive sleep apnea, arthritis, hypertension. So you qualify with one risk factor, or the BMI is more than 30, and you're non-diabetic, and HbA1c has to be less than 6.5%. And the primary factor is the percentage of weight loss and 5% weight loss. Now, Dr. Heller is out here. He would know that with all nice guidelines, we started with 5% weight loss. That was the primary target because that was shown to show benefits in a lot of factors. So all the trials in STEP, the primary outcome is always 5% weight loss. The secondary outcomes, dil mange more, can be 10%, 15%, and improvements in blood pressure, HSCRP, cholesterol, and other factors. But the primary aim that you're looking at 5%, that would be consistent among all STEP trials. In the STEP trials, there would be 2 arms, placebo arms and semaglutide arm. Semaglutide arm, the dosage will grow up. All these patients would have a 500 kilocalorie deficit loss from what they eat, and they would have to do 30 minutes of physical activity 5 days a week. So that was there in both the arms, and this was the quality factor. So I'll not go with all the trials that are there because these fundamental points remain same for that are there. So what did it show? It showed that when you do that, there is a 16.9% weight loss at 68 weeks versus a 2.4% reduction that is there with placebo. So remarkable weight loss that happens, and the curve keeps going down and down and down. So point number 1, does semaglutide makes you lose weight? Yes, it makes you lose weight. It is around 16.9% in patients who are obese and non-diabetic over 68 weeks of time. What is this percentage of weight loss? So as I said, the primary factor we were looking at is 5%. So it achieved 92.4%, which is statistically significant. And the secondary outcome was 10%, 15%, which is also there. But yeah, when they looked at data, they also found 1/3 of these patients had 20% weight loss, though that was not a defining criteria when they started the trial. At pre-trial, what was the primary and secondary points? It's just when they looked at it, they found that yes, there is 20% weight loss, and there was some improvement as we would expect with the waist circumference and blood pressure and HbA1c, even though they were non-diabetic patients. The most important question that comes in clinics when you are going to prescribe in India, because patients pay out of their pockets, they're going to ask, how long will I take? What will happen if I stop? Kitna din lena hai, doctor? Uske baad kya hoga? So that is exactly we are looking at effect of maintaining step 4 trial versus treatment withdrawal. So what happened? again they will taken in, and at 20 weeks, when they had around 11% weight loss, 2 arms were made. So one arm continued to take Wegovy, one arm was placebo. And they found that who continued to take, again, roughly similar at 68 weeks, 16.9, 18, 17%, 18%, there's not much of difference. But the one who stopped that arm gradually started gaining back weight. So if you stop the treatment, you will start regaining weight gradually going back. So that has to be counseled to the patient when you are doing it. Otherwise, he may not be happy. Generally, they will ask you, because moment drug is a little expensive, the second question is, how long will I have to take? That's the first question that will come. This afternoon, I was giving a talk in Calcutta on this, and doctor said, how long will I sit? I said, you don't ask that question when you're prescribing SGLT2 or metformin. You're asking this question because it's expensive. Otherwise, nothing else changes. That is there. So this is step 4. Again, there is meaningful weight loss. Something, help me with audio visual, please. Something has happened. Okay, we'll close some windows. Hopefully it will work. No, it's got stuck. So while that's happening, can you move on my slide? So again, similar story, 5% weight loss, 10%, 15%, and 1/3 of the patient at 20%. This is a very nice step 1 extension. Now, what is step 1 extension? Step 1 was 68 weeks. We showed that it causes 16.7, 17% weight loss. Next question, patient will say, "Ek saal le liya hai, now I'm going to stop. What will happen to me?" And this is what it shows, that if you stop the treatment, you gradually start regaining weight, which has been what has been showing with step 4 as well. So that's 2 trials kind of reimposing that if you kind of stop, you're going to restart getting your weight. Step 5 is now looking at what happens over a longer duration of time. We looked at 68 weeks. We know it loses weight. We know if you stop, you start regaining weight. Now you want to look at what happens at 2 years. And that is what step 5 looked at. Obviously, as I said, all these points remain same in all the trials, 500 kilocalorie, 150 minutes. So I'm not going to repeat that. So what it shows is that it maintains, so it reaches what it needs to reach around 68, 70, and that it plateaus and it stays there. So the weight loss is consistent, reaches maximum around 68 to 70 weeks, and it stayed there like that for 2 years time. So next question is, 2 years is fine. We want more data, So I was taught in UK, whenever you said, you always find, you ask, why not this, why not that, why 2 years? So we got a 4-year data from the SELECT. What happens that if you continue in SELECT, I know we've got a cardiologist going to tell us about it, so I'm not going to go into his territory. But if you look at the 4-year data that is there with SELECT, again the same story, reaches its maximum and continues to remain on for 4 years. So any semaglutide, causes weight loss. The data shows it causes weight loss. If you stop, you're going to restart gaining weight. You reach maximum around 68 weeks, and that is consistent at 2 years and 4 years if you continue the medication. Safety profile, if you compare the predominantly factor, which we all know would be the GI problems that are there, rather than that, and other than that, placebo versus were relatively reasonable. It comes with all the pens, all the colored pens, and you dial the full dose and you click it and you wait for the click, click, click to stop clicking. And then that is they come with 4 needles that they've given you. And I've been told that that you can keep it 6 weeks once you've started using the pen outside the fridge. Because of its studies, it may lose its efficiency. So, but in 4 doses, it will finish. People may experiment using microdosing, but that's not a validated thing that is available, or that cannot be, one cannot vouch for the microdosing that can be done with a higher pen that is there. So you start and you dose up. If you have a problem, you stop there or dose down till you reach the maximum that can be there. So you can move from 0.25 to 0.5 and keep going up where the patient can tolerate. If you find a lot of intolerable, you can dose down, wait for it to stabilize and go up. As we know, in practice, medical practice, nothing is written in black and white. We all practice gray, and the varying degrees of gray, from light gray to dark gray, so you can decide how you want to play around with this patient that needs to be there. Semaglutide is licensed in India, that has been said. Now, if there are GI side effects, what is the advice you're going to give the patient if they've got GI side effects? I think that should be advised to given to all patients. Have smaller meals, eat less, eat slowly, eat less fried foods. That should be given to all diabetic patients. That can be done, and there are some suggestions that can be done. I like the suggestion of this mint ginger based prickles and biscuits, and I'm sure, I cannot say I will ever experience this, but people who have been pregnant, I've seen that those advice is given over the counter. Eat some ginger biscuits, eat some apple cider, that might help. So all those supporting therapy, increase more fluids and other things may help avoid strong smells. You can use prokinetics and PPI if the need be arise. What happens if you miss the dose? I think if it's within 5 days, you can take the dose and take the next dose as scheduled, or if it's more than 5 days, just forget it. Stick to Sunday that you are taking. It depends on the patient. You need to ask him what really works for him. Sunday works or Friday works or whatever works. Whatever works for him, we can start on that dose and remain on that. As I said, you can titrate up and down based on that. With that, I end my slide and thank you so much.